I'm with Eric again. He's in Walnut Creek, California. I'm in Vermont, and this is Eric Maisel. Thank you, Eric, for doing this longer interview. I really appreciate it.
Of course, my pleasure.
So, you were introducing yourself and mentioning the work that you've been doing uh, most recently in the future of mental health, the book that you put out, but also I know you're doing a series in Psychology Today, interviewing a lot of innovative therapists as well as people who are putting out some work that really gets people thinking, I think, about where are we with mental health care and what are some of the issues that we face with the biomedical model. And I know that you're going to be also writing a book about kids because you have a particular concern about children right now and what they face if they're being treated more in the biomedical model than some of the more innovative integrative techniques that are available. Would you say a little bit more about your book, The Future of Mental Health, and the direction that it takes, and especially about the people who are coaching within that model that you are writing about?
Well, it's interesting. Because it's a complicated subject, there aren't excellent short sound bites in this area, which makes it difficult to communicate to a layperson who has no expertise in this area. A layperson will not know, really, that the Diagnostic and Statistical Manual of the American Psychiatric Association is a book, is a document that is the diagnosing Bible by which all psychiatrists, psychotherapists, and anybody who does mental health diagnosing uses. Around the rest of the world, there's another one, the ICD, but we use the DSM. And the DSM is an odd document. It's silent on causes, it's silent on treatment, and it's really a shopping catalog for selling so-called disorders based on what's called symptom pictures. So if you're having some trouble sleeping and you've put on a few pounds, there's no particular reason why those should be linked together and called symptoms of a clinical depression, but they are nowadays. These are taken as symptoms of a clinical depression. And so you walk in to somebody's office, a professional's office, and you say, I'm sad, but you would never say that anymore. We've lost the word sad. You'd say, I'm depressed. And the person sitting across from you would say, yes, you're depressed, and start handing you a prescription. That's why the typical amount of time in a psychiatrist's office now for a first session is 15 minutes. What can go on in 15 minutes? All that can go on is a certain kind of transaction where I say, I'm sad, and you say you're depressed, and you start writing me a prescription. So we're in a very funny time. It's been going on for about 70 years now since the first DSM came out, where millions upon millions of folks think they have this thing called a mental disorder, when in fact they just have certain problems in living. And far too many people, especially far too many kids, are being forced is not exactly the right word, but being asked to take chemicals with powerful effects that have powerful side effects also, and that may not be useful to them. So, to make that a long story short, for the folks who are watching us, I would invite them to come to my site, thefutureofmentalhealth.com. I have a reading list of more than 100 books there in this area, which will really help educate them about what's going on there. The movement that I'm in has 3 different names. We haven't settled on a name. Sometimes it's called critical psychology, sometimes critical psychiatry, and sometimes anti-psychiatry. But it's a very important movement. And if you're a parent under pressure to have your child receive some mental disorder diagnosis, really hope you'll do some reading to see if that's a legit enterprise, if that labeling of your child is a legit enterprise. Because I think right now, every behavior of childhood, everything about childhood has become a symptom of mental disorder. And it's really not fair. And parents are under a lot of pressure to knuckle under and have their child diagnosed and medicated. And that's a shame.
It certainly is. Speaking as a grandmother of two, and noticing just what's going on with the kids in with also the other their peers and the stories that I hear about what's going on. So thank you for speaking to that. So Eric, as you know, I'm very interested in spiritual emergency, which is again a name that a lot of people, some people don't like at all, and so we're settling on different names. It could be
Exactly.
transformative crisis or a psycho-spiritual kind of event, or etc. But it has been confused with psychosis. So going along with the theme that you have in your book, there are many natural life processes, ups and downs of life, let's say, that are being medicalized these days. When people get a little bit sad, they might be called depressed and given a script, as you just went through. And
Yep.
sometimes people have an extreme kind of event going on, or they move into an extreme kind of state of consciousness, in which they may have experiences of feeling the God within themselves, as well as a lot of old psychological material arising at the same time, and they get, frankly, overwhelmed. So, spiritual emergency, or a phenomena of spiritual emergence has been used to describe such an event so that people can get the kind of care you speak about with peer support or a life specialist who can assist them to integrate the experience and not medicalize it, but integrate it in a way where it becomes a natural part of life. It's okay. There's not the stigma of a mental illness. Could you speak a little bit to this area of psychosis and how it fits within your theme as you see it?
Sure. The starting place is the labeling place, and that's the use of a word like psychosis or schizophrenia. Those are unfortunate words, and they're actually illegitimate words because they don't stand for anything in particular. It would be smarter if we could talk about the behaviors or the events or what's going on. To have an auditory hallucination is to have an auditory hallucination. To then add some language to that and say you have the mental illness of schizophrenia does no good and no help, because there's no medical evidence, there's no scientific evidence that that word means anything in particular. In fact, the head of the National Institute of Mental Health said about 2 years ago, and no one quite heard him, there's no such thing as depression or schizophrenia, meaning the labels are not useful. We should be talking about what's going on. Well, one of the things that's going on is that person in that state is often a difficult person. And so society, in its watchdog capacity, wants to do something to that person to make the rest of society feel safe. So that's one of the characteristic problems when we're talking about psychosis, is that there is a containing energy around that person to keep that person's virus from infecting other people or overwhelming other people. So that's a problem for the person, is that they're probably going to be handled roughly, so to speak, by virtue of the fact that they're having a difficult moment. But that aside, there are many things to help that person different from medication. There's an idea called communities of care, that is, communities around the world where people who are not called patients or clients, but sometimes visitors or some other kind of word, find a place where they can live out this moment safely without need of medication. There's a method in Finland called the open dialogue method, where if somebody is having one of these episodes, we'll call it, or one of these events, all of the helpers jump into a truck or a bus and go to that person's home and sort of hold the person energetically and try to understand that person's language, because a person in this state often is creating personal language that's hard for someone else to understand, called neologisms, which are often very interesting, very poetic. In fact, the open dialogue method folks call what they do poetry rather than therapy. So there are different ways to handle a person going through whatever it is they're going through. As to the what it is, you're speaking of it as a spiritual emergency. Whatever it is, I I can see it as the following sort of thing. This is my conceptualization of what's going on there, and it's just a guess, because no one knows. The British Psychological Society came out with a big report, maybe last year, called Understanding Psychosis and Schizophrenia, in which they made the following assertion, that as many as 75% of folks who are hospitalized with psychosis or schizophrenia have experienced multiple early childhood traumas. If that's the case, if there's some truth there, then I could see a person who has experienced an early childhood trauma starting to live inside her head more and more over time because the world doesn't feel exactly safe and because she's trying to process what happened to her. I think that indwelling, that being too far inside, may be the way in which a person starts to, quote, break with reality, start to maybe have auditory or visual hallucinations. So I think we could possibly figure out that this is a natural process arising from an unsafe situation and an attempt to garner or create some safety for the individual. As I say, no one knows what's going on, but to treat it as a medical crisis is simply wrong. It's simply an assertion of power by people who have power and the forced medication of folks who may be going through something that's not medical at all.
Thank you. That's very beautifully articulated. As far as I'm concerned, I really like what you had to say. And I appreciate your quoting that particular book, Understanding Psychosis, which I'm also making available to the students in the course who that you're going to be involved with. And I also appreciate your quoting Thomas Insel from the National Institutes of Mental Health, because it was quite astounding. He made several comments that basically lead to the fact that we have no biomarkers for these things we've been calling diseases like psychosis or schizophrenia. Yes, there are neuroimaging techniques we can have that can show us how the brain is functioning when people are in these extreme states, but that doesn't mean it's a disease of the brain.
That's right. No, that's right.
Yeah. So we're in a very interesting period of time where we thought...
I'd like to piggyback if I can,
Sure.
Because what would be really useful for people interested in what we're talking about, for them to know, is to actually go to the definition of a mental disorder in the DSM-5, which is the latest DSM, and if they have the patience, to go to the definition of a mental disorder in the DSM-4. The definition of a mental disorder changed radically from one to the other. Neither definition makes any sense whatsoever. I could not quote it to you because it's a string of meaningless words. It's like 150 consecutive meaningless words meant to encompass every human behavior. So fundamentally, everybody is diagnosing, psychiatrists, psychologists, psychotherapists are diagnosing on the basis of a meaningless definition of a mental disorder. So fundamentally, something is wrong at the very basis here. And if folks are interested to see how much quicksand is underneath what's going on here, they ought to go take a look at the very definition of a mental disorder and just see if it makes any sense to them. I don't think it will.
Thank you. Very simple, very direct way to do it, and people can do it through the internet as well. Access the DSM
Absolutely.
And get that definition. No going to the big book.
No, don't buy it.
Right. So, and a lot of our leaders, even when the DSM-5 came out, said this book really is invalid in a lot of ways, and we're encouraging people not to use it in at least with the kind of authority that it had been given in the past.
It should not be used at all because it is just a shopping catalog. It says nothing. It tries to act as if grouping so-called symptoms together means something, and it doesn't. Mm-hmm. I could name 7, quote, symptoms of you being bored, and at the end of that I could say you have the mental disorder of boredomitis, and it would be a completely illegitimate enterprise. I could say, well, you don't seem to be very interested in the book you're reading, and you don't seem to be very interested in the TV show you just watched, and etc. Those are not symptoms of mental disorder. That's just you being a human being. But that's what the DSM does. It looks for those kinds of things. For children, it looks for things like squirming and saying no, and just all of the things that make up childhood, and tries to name them as symptoms of made up, illegitimate mental disorders.
Mhm. I smile when I hear you say it, because it's absolutely what children do naturally, exploring the world. And yet, when it gets right down to it, what you're describing is something that is just profoundly sad and disruptive to the way that we address children and parent as well as educate. So, thank you so much for your dedication to that particular piece. And I'm speaking as a grandmother as well as someone who cares.
Yeah, and for folks who are interested, just maybe 2 weeks ago, time flies, so I'm not sure if it was 2 weeks ago, but Congress passed new horrible legislation. They managed to pass nothing useful, but they did manage to pass this horrible bill, which allocates billions of dollars to primary care physicians to now try to predict in infants to 5-year-olds who's going to come down with a mental disorder, who's going to be depressed later in life. This is a new way to medicate young children. And it's really, it's quite horrible. I don't know that there's any way to stop it, but this new idea that if your parents who are depressed, namely, got sad somewhere along the line, that maybe predicts that you will get sad somewhere along the line, which of course you will, and therefore you might as well take antidepressants now at 3 years old. I don't know how we stop this, but we'd better.
Yes. So, Eric, I'm feeling full of a lot of things that I could ask you, but I'm going to steer this a little bit towards asking you to describe, please, how you see the role of this new kind of coach, or whatever the label is you want
Human
to put it.
experience specialist is the person I'm.
Yes.
There is no role for this person in society now because she would be faced with too much litigation. She'd be sued right and left because she would be saying things that do not amount to the standard of care. The standard of care is medicating people, even if they ought not to get those chemicals. So she can't really exist. This is really a mind experiment right now. But what she would do are things that any working professional could begin to do, could begin to move even within their license. Any psychiatrist, any psychologist, any psychotherapist could begin to move in the direction of actually caring about your circumstances and actually caring about your life experiences and actually taking you hating your job to mean something and actually taking your unhappy marriage to mean something and to expect you to be sad or without sufficient life purpose or without sufficient meaning in your life, if that's how you're experiencing life at this point, and to be much more direct and energetic in asking you, what do you think might help with meaningless, or what do you think might help with lack of life purpose, or what do you think might help with your sadness? What do you want to change? That is the kinds of questions that a coach might ask if a coach weren't afraid to be in psychological territory. So if one could picture sort of the good listening skills and savvy and psychological understanding of a good psychotherapist with the energy and forward-lookingness and goal-orientedness and solution energy of a coach, if one could picture that person coming together, that's who I think the helper of the future ought to be. As I say, I'm not sure that person can exist because the American Psychiatric Association, the American Psychological Association would come down hard on that person, and I'm not sure she'd want to stay in litigation for the rest of her life. But that being said, the idea is important, that there is a way to marry the energy of a coach with the psychological understanding of a psychotherapist and come up with a new person.
Well, I love the model. And I've been exploring the peer support model, especially through, in Vermont, intentional peer support that was created by Sherry Mead, and been deeply impressed with that. And clearly it's showing a lot of positive results, providing peers for peer support because it's economical and it seems to
Yes.
be getting results. But
And it seems to slide in some place in the litigation. It seems to slide somewhere, just as the psychiatric survivor movement does wonderful work and also seems to be a little bit inoculated from litigation. So it's interesting what manages to be acceptable, which
yes,
useful things manage to be acceptable.
right. And when you're describing the kind of uh, person that might be ideal in the future,
Yep.
I think too that that person has some of the attributes of the elder in a tribe.
Yes, that's right.
Someone who has lived long enough to have acquired some kind of natural wisdom and about the ups and downs of life, and has maybe acquired some form of being a balanced human being, so that
That's
they can
right.
be a model to others.
Just like a real grown-up would say to someone who's lost a child, you may never get over that, as opposed to now you have clinical depression, or you know just a
Yeah.
normal human thing. This is going to be beyond hard. Or if you're living in poverty, you going from not even one paycheck to another, but just super struggling, any wise person is going to say, this is incredibly hard. Of course you're going to be anxious. Of course you're going to be sad. Of course you're going to experience stress symptoms. Of course this, that, and the other thing. What would we be surprised about here? This is horribly hard. And let's see what we can do to make it slightly less hard or to help you, given how hard things are.
Yes.
Scott Peck started that book that everyone loved, The Road Less Traveled, with a simple sentence: life is difficult. And there's a way in which the current psychiatric movement is trying to act like life isn't difficult, that the second you're demonstrating some difficulty, we're going to call that a mental disorder, as opposed to just honoring that life is basically difficult,
Mm-hmm.
and that we have to deal with lots of things in life. As you say, that's what any wise elder would know. Things happen and they're difficult, and we can only do the best we can.
And I would add another element to this, which you may or may not agree with, which is just community can be so essentially important. And again, if you go back into the tribal or indigenous cultures, you see that people could not only appeal to the elders for assistance, balanced elders, but they had the community to hold them as well. Not
You
that
bet.
that takes care of all your sadness or all your gloom when you have a
No,
difficult
but
circumstance.
for me, I would maybe reframe or think about what you just said as 12-step movements, because something like Alcoholics Anonymous, I think, is wonderful. Whatever one's connection to higher power, however one takes the God piece of that, the support offered there, the power of saying out loud, I'm an alcoholic, the idea of sponsors, the 50 things we could say about Alcoholics Anonymous and other 12-step programs. They work, they create community, and they're very valuable. And I think for a lot of people, they could not ever get sober on their own. It might be nice if they could, but if they can't, to have community there of this sort is life-saving for them. So whether you mean community in one sense, I would hold that as a model of community for me, that kind of support group that really works.
Yes, and you also mentioned open dialogue, and the people who are trained in open dialogue kind of getting
Yes,
in the bus to be the support, and I think they function as the community, at least in Finland, where this was created and where we can
that's
find
right.
the model of success. So,
That's right. And the communities of care, too. One that I've been interested in recently is Gould Farm, which is in Massachusetts, and it's now been around for a very long time. I'm not quite sure how long. I don't think I'll try to name the date, but it has this model of creating community and trying to normalize whatever the experience is of the person coming in, or to try to not abnormalize it, but just to have the person feel like they're a human being, to give that person the same ordinary task that everyone else is doing, weeding the garden or raking the leaves or baling the hay, just trying to make life more simple in a certain sense, and embracing the person rather than having this great, grand, expert distance between professional and patient. That distance may be warranted when it comes to your urologist or someplace, but it's not warranted when it comes to your sadness.
Yes. Well, Eric, we're nearing the end of our interview, and I want to thank you so much for everything you said. It's been very inspiring for me to listen to you, and I'm sure other people listening will also feel very affirmed by what you're saying. Is there anything that you'd like to say towards as completion for you today?
No, I think I would just invite people to come visit with me. My main site is ericmaisel.com, and that's ericmaisel.com. And my blog for Psychology Today is called Rethinking Mental Health. So if folks want to come visit, I'd love to see them.
Okay, well, thank you again, and I really appreciate the time that you've spent with us today. So I'll say goodbye now. Yes.